Hi, good evening. Our topic is a nursing research synthesis examining the impact of culturally competent nursing care on Black maternal and infant outcomes. And our group members are myself, Amanda Cohen, Evelyn Romero, Priya Shah, and Taylor Gutierrez. So according to an article we found written by Boki and Pendergast, Black women in the United States are 3 times more likely to die from pregnancy-related causes than white women. These disparities are not simply about health conditions or income. They're rooted in systemic racism, provider bias, and the lack of culturally appropriate care. Many Black mothers describe feeling dismissed, ignored, and pressured during childbirth, which directly impacts both trust and outcomes. The purpose of our project is to synthesize nursing research on this particular issue and identifying common themes, research gaps, and practical implications for nursing practice. Our PICO statement demonstrates how we aim to synthesize nursing research on how culturally competent care, as opposed to standard care, has the potential to improve Black maternal and infant outcomes.
To find our articles, we primarily use Google Scholar and EBSCOhost database via Baylor University's Library OneSearch. We use specific keywords such as access to care, culturally relevant care, Black maternal health, socioeconomic status, and barriers to healthcare. Our articles were also filtered for qualitative and quantitative studies, and any meta summaries reviews were excluded. Results were also filtered to include only peer-reviewed journals published within the last 10 years. 6 articles were found, and 3 of them were either co-authored by a nurse or published by a reputable nursing journal.
Now I'll be walking through the synthesis of findings from those specific 6 research studies that we examined that looked at Black maternal health outcomes as well as infant outcomes, in which those compared standard care to culturally congruent models of care. So first, across several studies, including those by Boki and Prendergast, Cantor, and Snowden, it's clear that standard maternal care often failed for Black women, both systemically and interpersonally. Boki and Prendergast emphasized how systemic racism actually limits access to quality care. Cantor's study found 4 main concerns, which were structural healthcare challenges, negative provider interactions, a strong preference for racially concordant care, and a lack of mental health support. Snowden's research adds a quantitative perspective showing that culturally congruent care, such as the Mothers Rising program, led to better maternal health outcomes, specifically longer gestational age. Altogether, these findings suggest that standard care models are not meeting the needs of Black mothers, and that cultural disconnection and bias are driving poor outcomes. On the other hand, studies by Almanza, Hunt, and again Snowden show the benefits of culturally centered maternal care. More specifically, Almanza studied a Black-owned birth center where mothers reported greater autonomy and respect. Hunt's research looked at the Healthy Birth Initiative, where providers built trust by being emotionally and culturally engaged with patients. Again, Snowden's work confirmed that culturally aligned programs are not only just meaningful experiences, but they actually contribute to measurable improvements in clinical outcomes. Altogether, these studies show that culturally congruent care models and fosters respect, autonomy, and safety, all which are elements that are seen missing in traditional hospital settings. Now, importantly, Smith's study adds a word of caution. Cultural competence cannot be just superficial, and it must extend beyond training and address community specific needs, as well as directly confront systemic racism. Without that, progress is limited. Now, looking closer at the qualitative research we looked at, especially from and Prendergast, as well as Hunt, Smith, and Cantor, we see a shared emphasis on community-based interventions. These studies highlight how racism, invisibility, and mistrust affect care experiences. One quote from Boki's study stood out to us, and that was, "There is nothing to protect us from dying." That speaks volumes about the vulnerabilities felt by many Black mothers. Still, Hunt's study reminds us that organizational challenges like staffing shortages or institutional policies can interfere with culturally competent care, even when the intent is there. Provider burnout is also a barrier, and addressing that is essential for sustaining high quality care models. Now, in terms of quantitative outcomes, both Almanza and Snowden used strong statistical methods. At the Roots Birth Center, clients scored significantly higher in autonomy and respect, as shown by the MADM and Mori scores. Snowden's data also showed a significant increase in gestational age among mothers rising participants, though other clinical markers like preterm birth and birth weight did not reach significance, which suggests the need for further research. Bringing all 6 studies together, the message is clear. Culturally competent care improves both maternal outcomes and the overall experience of care for Black women. The literature strongly shows that standard care fails to address key barriers like racism, provider bias, and lack of cultural understanding, while culturally congruent care models help to restore autonomy, trust, and ultimately better clinical outcomes for mothers and infants. To truly realize the benefits of these models, however, efforts must extend beyond simple awareness training. Structural change itself is necessary, and that includes investing in community led care, more Black maternal health professionals, and healthcare systems that are actively committed to dismantling systemic racism. These findings represent more than isolated interventions. They point to a broader call for health equity and justice in Black maternal care.
As the synthesis of the 6 research articles shows, Black mothers greatly benefit from culturally congruent care in the healthcare setting as opposed to standard care. And as shown in the 6 studies, this positively impacts the Black maternal experience and Black maternal and infant outcomes. Through this synthesis, we realize that culturally congruent care promotes patient autonomy, respect, trust, and strengthens the client-provider relationship. Using the Stetler model of evidence-based practice, we look through phase 1, phase 2, and phase 3 to determine how the 6 articles can influence nursing practice. We specifically focused on how nurses can help exercise their role in advancing health equity when it comes to Black maternal and infant outcomes. The first step of the EPB model is preparation, determining the problem, which we have shown through our PICO statement and through the introduction of this paper and this poster. Phase 2 is validation. Are the studies that are strong in research evidence? Our strongest research evidence study was Snowden et al., which was a quasi-experimental study. However, it was difficult to find other studies that were experimental or quasi-experimental, which shows there's a gap in the literature in looking at how interventions impacts Black maternal and infant outcomes. We had a lot of qualitative studies that talks about the experience, but we want to see more studies on how these can influence patient and maternal outcomes, maternal and infant outcomes, sorry. Our 2 recommendations based on the synthesis of these studies is number 1, advocating and promoting a racially concordant care model. This is when the provider and the patient share the same culture. It has been shown that when this happens, not only do mothers feel more respect, trust, autonomy, but affinity groups kind of have that trust already established between them. Our suggestion is that nurses advocate and promote a racially concordant model in 3 different ways. The first way, advocating for programs aimed at retaining Black nurses, midwives, and obstetricians. Number 2, advocating for partnership with Black-owned community birthing centers, such as Roots, which was one of the articles in this study. And number 3, supporting home visiting programs created by and for Black women, such as the Mothers Rising program in the Snowden et al. Study. Our second recommendation is that advocating for institutional policy changes, nurses should advocate for institutional policy changes that mandate lower patient to nurse ratios so that healthcare providers have an opportunity to build rapport with patients and provide culturally competent care. A lot of the studies that we looked at showed that mothers really appreciated when their issues were discussed, when they felt that the provider had time for them. Additionally, we saw a study on how providers felt themselves about the care that they were providing to Black mothers, and a lot of them expressed a bit of frustration that they didn't have enough time with patients. Through these 2 interventions, nurses can advocate for changes that lead to better, meaningful patient-centered interactions that are culturally competent. And we believe that through these actions, we can improve Black maternal and infant outcomes.
In reviewing the research, one conclusion is clear. Culturally competent care consistently improves maternal satisfaction, birth outcomes, and feelings of dignity and respect for Black mothers compared to standard care. These benefits are strongest in community-based, racially concordant models that prioritize respectful communication and give patients a real voice in their care. However, our synthesis revealed important gaps. Most studies focus on short-term gains like autonomy and communication, with far less data on long-term outcomes such as maternal morbidity and mortality. We also saw how systemic bias, staffing shortages, and limited resources remain persistent barriers to implementation. In the future, nursing research needs to develop reliable tools to measure cultural competence and its outcomes and explore how these care models can be scaled and sustained across different healthcare settings. By doing so, we can move beyond short-term improvements and work towards lasting equity in maternal and infant health. Thank you so much for taking the time to listen to our research.